Well, hello, Cam followers. It's lovely to see you. I feel like I've been here not too recently. It's a little bit intense on the lives at the moment. I've got the gorgeous Katrin Jahn back to talk about pain and behaviour. Prior to letting her introduce herself, I'm just going to quickly do a plug for one of the resources that Cam provides, which I want you all to know about. It's very important to me. Partly because it features my dog, Holly, main character. This is called Why Don't You Listen? It's an illustrated children's book that we had created many years ago. I got stuck in a Moscow airport because I got my visa wrong. Had nothing to do for 24 hours, but I cried because I couldn't get back to the UK. And I decided to write a children's book because the intention is if we have parents reading to the child, I actually get parents and child at the same time. So I influence a greater population of people. Parents see the importance of this book because no parent would ever want their child to be bitten. And the most common people to be bitten by dogs are children. Facial wounds, terrible. And I'm hoping that this will be a resource that will influence a bigger population, will get the message out there quicker. Illustrations are all done by a lovely guy called Phil, who actually benefited from being part of CAM. And he did this for free to keep CAM going. So this is one of our fund generators. So I'd really like you to go and have a look at it, buy it, stock it, put it in your shop, put it in your school, put it in your library, take it to Brownies Cubs. Do they still exist anymore? I don't know. But whatever, I would really like you to disseminate this book. And if you're a drug company, a food company, or any kind of company that thinks, oh, we could do this as a giveaway, just get in touch. That's absolutely fine. Right, I'll put it away and I'll shut up. Katrin, please tell us about yourself.
Hello. So lovely to be here again, Hannah. I'll introduce myself quickly. So I am a vet. I've been a vet for over 20 years now. I actually am based in the United Arab Emirates. So I own a small animal practice in Abu Dhabi. We are gold standard cat friendly and we are also fear free. And a couple of years ago, once I could kind of step away from more the clinical side of my practice, I embarked on a residency in Veterinary Behaviour Medicine, which I've almost completed. So I hopefully finish next year and I'll be hopefully sitting my exams next year. And so as part of that residency process, I had to see 400 clinical behaviour cases. And the way that Hannah and I sort of met was that I realized whilst seeing all these cases that a huge amount of them actually have a physical underlying cause, a physiological underlying cause, and more often than not, that was pain related. So whether that was acute pain, chronic pain, gastric pain, gastrointestinal pain, pain or discomfort coming from skin disease. So there were so many elements of pain that it really made me kind of sit up and listen. And it was really interesting. I would say probably, I'm going to do a guesstimate, but 70 to 80% of my behavior cases have some physiological component to them. And a lot of time that is pain. So that's how we kind of met each other. And since then, Hannah's done some training for my practice in Abu Dhabi, which we need to repeat quite soon. And I'm an avid lover of all things CAM.
Thank you. Well, we're mutually very respectful of each other, aren't we? So let's crack on because this is a huge topic. It's a very topical topic, and which is exciting for me because we were just talking about how CAM's trying to get reach into maybe insurance companies, other ways to disseminate a message that needs to be shouted. And the apathy around arthritis, chronic pain is still there. It's still there. And one of the things that I have noticed in recent years is pain and behavior. People want to listen to this. And this is my gateway to talking about all the other aspects of chronic pain management. So I want to take full advantage of your time exciting our followers with all of these angles that we could identify pain hopefully earlier. So we did do a bit of an agenda. Bear in mind that you've had a crazy day.
Yep.
I'm just going to start off with the disclaimer. So at the beginning of this live, I want all of you followers to understand this is a developing field. It is an area where when you actually look at the literature about behaviour and pain, it's still quite poor. So if you go to your vet and say, well, I heard on CAM that this behaviour is linked to pain, do not be surprised if they're quite taken aback, feel a bit on the back foot, and don't immediately get the association, because this is still quite new, isn't it?
I mean, I think that's one of the massive things that chronic pain management and behaviour have in common, is that they're both fields that are still quite new. And I think, perhaps a little bit in the behaviour world, we have an advantage, I'm going to put that in inverted commas, that, once a behaviour gets to a point where it's really difficult to live with, I think people are more motivated to do something about it, whereas that might not always be the case with chronic pain. But yeah, I think, the veterinary industry in general, we're not very well educated yet. It's getting better on either chronic pain management or behaviour, and that's why it's so important to start really making these links, talking about it more, talking about it in different platforms. But yeah, I agree that it might not be instantly obvious to your vet if you say my dog's behaviour has changed. Can that be linked to pain, especially if there are no obvious clinical signs of pain, such as changes in gait or limping, or obviously palpable pain? That can be quite discerning sometimes for vets, because they're not really sure what they're looking for. So yeah, we need to shout louder about the behavior changes being oftentimes the first thing to change when we do have pain present in an animal.
Yeah, definitely. So I'm going to bring in the suspicion of chronic pain little PDF, which I know Lynn, my lovely Lynn, will put a link to. I think because I spend all day, every day talking about pain identification, awareness and management, that it's always in the forefront of my mind whenever I see a dog brought in that's got abnormal paws, overgrown nails, arches to their back, changes in coat. Owner mentions they've become grumpy, they've gone off their food, they don't jump in the car, and I'm just like, pain. So with that, a few years back, we created a PDF called the Suspicion of Chronic Pain document. And it's basically a crisscross with, in the center, the word chronic pain, and at the top it's behavior change, 3 little opportunities to write observations. At the side, posture change, 3 little opportunities. Physical changes, which could be coat, muscle, nails, 3 little. And on the final side, capability and gait changes, 3 little opportunities. And the reason we did this is because we actually had a groomer, 2 groomers approach me at a conference and say, help us. You're telling us these things. We're observing them in the clients in our care. We're telling the owners that we suspect there's a problem, but they're not believing us. And if they are believing us, by the time they take that information to the vet can't see it. So then the owner of the dog comes back and says, thanks for wasting my time. And then they could potentially lose that trust relationship, lose business. And they were like, help us. So we ended up creating this, and it's used worldwide now, which I'm super proud of. And it's a really good way to bring the behavior as well as physical aspects. As Katrin absolutely rightly says, sometimes there are not physical things to easily find. But in a lot of cases, especially OA related, there is. So please make use of that document. Thank you, Lynn. You're amazing. So how do you want to play it? Do you want to start with talking about why pain and behavior is so obviously linked? Just kind of go through yes, so people get it, and then we'll talk about some cases, or what do you want to do?
Yeah, however we want to play it, that's fine. I mean, I think in terms of sort of obvious behavior changes, I guess that the classic one it would be defensive behaviors, aggressive behaviors, as you said, being a bit grumpy, a bit snappy, not wanting to be touched in certain areas. That's kind of the obvious one, and I guess that would be the one that I would see most. It would often be an aggressive dog that we would then find pain in, and interestingly, until we actually treat and manage that pain, we don't manage to completely change the behavior. So that's, I think, a really important thing, because we can do a lot in terms of behavior, safety management and medications and behavior modification training, all that kind of stuff. But if we have that physiological component that's left untreated, we're never going to get the outcome that the client's looking for. So it's a really, really important piece. And that's why even if we just suspect pain, through sort of mild changes or mild signs, I will always err on the side of caution and suggest a pain trial. And then usually we find that that's sometimes the thing that then ends up making the biggest difference. So I guess, aggressive behaviors, defensive behaviors, snapping, all that kind of stuff, that's your classic. That's the most obvious. However, it can be a lot more subtle than that. Withdrawal, just looking kind of sad, down, not being as interactive with people. We can often get into dog or dog-cat aggressive behaviors or into cat aggressive behaviors, so interspecies, should I say intraspecies. So all of a sudden, the one dog doesn't tolerate the other dog so well anymore, or, the dog doesn't tolerate the young kitten that's just joined the family anymore. So there can be social elements to that as well. And that, I think, for my clients, that can be really difficult, that social part, because then you get the human-animal bond that starts to be impacted by that. And then all of a sudden things can shift quite quickly. So yeah, there are definitely obvious behavior changes, but there are also more subtle behavior changes. So I'd say always, be mindful if you see either, that absolutely pain could be a contributing part here.
I think it'd be good to actually clarify this term behavior as well, because the reason I'm going to say this, just let me rabbit hole a little bit. Me and Amber Batson did some work recently for a drug company. And because she's the intelligent one, she did the literature review, and because I'm the more practical one, I did the survey, and it works wonders. Perfect union of souls. But when we were actually talking about the findings from her literature review, there was the gait changes, the postural changes, and I was going, is that behavior though, Amber? Because my concept of behavior was an emotional component, a bigger, a rounded thing. Oh, they behaved in an emotional manner, But behavior can encompass motor behavior as well.
Absolutely.
Just the choice of moving away. So I've gone into an environment, something's hurt me, and I want to get away from it. And that is a movement away. That's still a behavior, isn't it?
Absolutely.
And I think people have a belief of what a behavior is. It's going to be a biting behavior. It's going to be an aggressive behavior. It's going to be a moody behavior. But when you talk about subtlety, it can be literally a movement, a repetitive movement, something that repeats itself. They choose to go away from a situation. They never used to do that. That's a behavior. That's a choice. They've moved away. So that's what you mean about the subtlety, isn't it?
It can be even more subtle than that. It might not even need to be a physical moving away. It might just be a turn of the head away, or a leaning away, or a kind of an unpleasantness in being touched, physically touched, like a shift away. So that it can get even more subtle than that. But yeah, that's absolutely what I mean. And if you think about aggressive behaviors, which would be, growling, barking, biting, lunging, snapping, all that kind of stuff, barking, not necessarily always, but those others, they are also all motor activities, if you think about it, perhaps with an underlying emotional motivation behind it, but they are all motor patterns. They're all motor behaviors. So, and when we think about what happens in the brain, there's always that motor activity that comes from the periaqueductal gray in the brain, which is where the emotion and then motor kind of pieces linked together. So yeah, when we talk about behavior, we always talk about a motor pattern piece to it. Absolutely.
And I think that's something that when we are creating this piece for this pharmaceutical company, we're like, please give us a chance to do some webinars about this, because people's perception of what a resultant behavior is, we've already got these preconceptions of what they are. And as you rightly said a little while ago, when we talk about behaviors, they tend to be deleterious. We call them deleterious, unwanted behaviors, because they're unwanted to us. They're inconvenient to us. We, as their human caregiver, don't like that behavior. So when identifying a behavior associated with pain, I think that's what we think behaviors are. But as you say, they can be very, very subtle. So I want the followers to open your mind to change.
So let me go a little bit even further than that. Sleeping more is a change in behavior. Sleeping less is a change in behavior. Sleeping less, being more restless, not being able to settle, that's a change in behavior. Eating less, eating more, they're all changes in behavior, even though they're very physiological, but they absolutely are changes in behavior. And they'll often be the first things that vets in general practice are faced with as well. Or he's sleeping more, he's resting more, or he just won't settle. And so they're all behavior changes. And then we have to dig deep and try and figure out, well, why? Is it only emotional, or is it emotional and physiological linked together, which in most cases it is?
Yeah, definitely. So I can remember, beginning of the journey, I was meeting these amazing souls like yourself, Gwen Covey-Crumb, Louise Clark, Claire Rossbridge. Oh my God, my absolute heroines. And I went to the Association of Veterinary Anaesthetists conference and saw the epic presentation by Sam Lindley about change. It's about change. But however, what about if the pain exists from a very young age and you don't detect change because they've always been like that? And I swear a lot of the room were almost sobbing, because when you get your head around, well, change can signify something. So if you see change, investigate. What happens when you don't see change and you've got an abnormal posture from a young age, and that abnormal behavior from a young age, an abnormal gait from a young age? And that's when I only say, well, he's always done it like that. You're like, there's always been a problem. But we'll come back to that. So we've got change in motor patterns, movement patterns, choice patterns. Can you just take a little bit of time explaining to people the difference between acute pain and chronic pain, why they can be subtle? Acute, quite obvious. It's a sudden onset. It's transient. Chronic, less so. Give them a little bit of an opportunity to get their head around subtle changes that come over time.
Yeah, and then there's also the acute on chronic. So, but yeah, I mean, chronic changes absolutely are more difficult to detect and more difficult to become aware of, because exactly what you just said, you almost get used to very sort of subtle changes and patterns that creep in. And if you're living with that animal every day, you might not necessarily notice a big change. And then as things worsen, that's just something that you take as read or take for granted. And only then, I think, maybe when you get an acute flare-up on chronic pain, or when that chronic pain turns into hyperesthetic pain or hyperalgesic pain, something like that, and then something changes, that's then when people kind of become aware of it. And then, when we do some digging, we find out that actually it's been there for a long, long time. So I do understand that it can be really difficult to kind of pick up on these chronic changes. But I think, taking photos and videos are really, really helpful. So looking back at videos and photos that you've taken of a pet, last year, even when I look at, so I've got one senior dog, Polly, who she's very arthritic and she's on, really kind of comprehensive management. And even when I look at photos or videos from her, even just a year ago or 18 months ago, I think, oh my God, okay, yeah, Polly dog, things are definitely progressing. So there are markers, I think, that can be really helpful in that journey. And that's potentially also then where your 6 monthly, 12 monthly vet checks come in. And, in preparation for that, just going through that kind of resource that Hannah just mentioned about doing, that kind of check of, are there potentially any differences, any changes that could signify that there might be pain there, and then keeping almost a bit of a record of that, and then repeating that every 6 to 12 months to see if any changes creep in. So I do fully appreciate that chronic pain is not the easiest thing to identify for caregivers and for professionals, but we have to start thinking more about it, and we have to start getting better at it 100%.
Yeah, definitely. And I think, so I just went to the Veterinary Osteoarthritis Alliance conference in Leicester last week, which was 2 days, multidisciplinary, real leader of conference. You know, it's a new concept solely about arthritis. Amazing. I was really happy. And the tools that we now have to treat is brilliant, you know. So feeling inhibited about identification, not being able to do something about it, we need to park that, you know, get rid of it. There is a lot available to be done now. I think another thing about identifying it early and thinking you're going to run out of options, park that idea as well. There's so much that we can do. Being aware of how prevalent it is a necessity. Work that's coming out from the University NC State over in America. We know that arthritis is a young dog disease. It's a young dog disease that we detect late. So beginning to be aware that it's hugely prevalent is massively important. And the final part of my monologue is we need to do something about it because it affects quality of life and longevity. And what does everybody want? They want their dog to be with them, happy, comfortable, independent mobility for as long as possible. And this is a chief player in taking that away from you. So if you are an owner of a dog that you think he's just got a bit of arthritis, he's just slowing down, if I turn around and say, come on, get it attended to, because that is going to shorten your dog's life. You're going to have less time with your dog for that disease. So all those elements need to come together, and then we will change the concept of chronic pain management, won't we?
Yes, we will.
It's not taking long at all, is it? Right. So let's start talking about some of these cases.
Yeah.
Let's do a really nice, direct, obvious association one where you were like, went in, saw the behavior, went, I can see what's happening, and we'll progressively make them a bit more complex.
Yeah. So I can think of a really nice, easy one. So a lovely dog called Max, who actually traveled over from the US to the UAE and was already a little bit older, actually, when he presented to me. So he was 6, I think. And again, kind of classic primary presentation was aggression. So had bitten visitors when they'd come to stay with the family, was really unhappy on walks, kind of being quite sort of reactive. I hate that word, but you guys all know what I mean when I say that, towards people and other dogs on walks. And the classic kind of piece about it, or the piece that really made me sit up and that we were sort of quite then easily able to identify related pain, was that the dog was having real trouble going down the stairs. So it started as he won't come out of the bedroom in the mornings. And then when we dug a little bit deeper, it was, well, actually, and then they sent me some videos, which was super, super helpful. The dog was standing at the top of the stairs and was showing classic sort of anxiety/pain signs of, kind of hesitating, sort of moving front legs, being really hesitant to start going down the stairs, licking lips, turning head away, a little bit of panting. And it took him he really had to kind of give himself a good push to actually make it down the stairs. And then the stairs were these kind of L-shaped stairs with a sort of a bit in the middle. So he'd get down the first flight of stairs, kind of pause in the middle, and then we'd have the same game again. So he would be really kind of worried going down that second piece. Anyway, and then he got himself down the stairs and then didn't want to go back up the stairs again, but did in the evening because that's where he slept. And that's actually what our dog Polly does as well. And she, I hardly ever see her go up the stairs during the day. Now she comes down in the morning and then she comes up to bed with us in the evening. And that's the only time she'll use the stairs. So based on all of that, we obviously did, talked about the safety management, behavior, all that sort of thing. And we did use anxiolytics. However, we also got the dog in for a full physical exam, noticed that he had pain around his lumbar spine, hip area, muscle wastage along kind of the tops of the back legs. And then on x-ray, we found really marked hip dysplasia, I think worse on one side, I can't remember which, than the other. And then started treating that dog with non-steroidals and laser therapy initially, and then gave some management strategies for around the house. I think we've started putting like carpets or non-slip mats up the stairs, so some kind of in-home management as well. And it really didn't take a lot. So the dog hasn't been on, I think he was on gabapentin initially to start off with as well, but he's now been on meloxicam only, as well as his behavior meds, as well as behavior modification, environmental management. And I think I haven't seen him for a little while now, but he was one of my earlier patients. And this was a couple of years ago now. And he's been doing so well with really quite simple management. But it was that final piece. I don't think we would have gotten him to where he is now behaviorally. So he now happily tolerates people coming into the home. He's a pleasure to walk now, all those things. And I don't think we would have gotten that final piece of the puzzle if we hadn't managed that hip dysplasia well. And so that was a really satisfying case because it was quite quite simple in terms of management. It wasn't too complex, and it was digestible for the owner as well, for the client. She feels really comfortable with sort of the combination of fluoxetine and the meloxicam that we have him on. And it's really managed it very well. And considering that he was 6, which is kind of middle-aged, I think in terms of quality of life, welfare and longevity as well, that's made a huge difference to that family. So that's a pretty simple, classic sort of presentation, I would say.
Yeah. And I love the fact that we've brought in the conversation about stairs, which gives us the opportunity to talk about hesitancy. Because I can remember many years ago, this would have been about 2018, one of the big drug companies invited us to do a contribution to a crib sheet, a rip sheet that vets could use in consult. So you could just rip off this sheet and hand it to the owner along with the prescription drug. And there was all the classics: difficulty rising, slowing down on walks, difficulty doing the stairs, difficulty getting out of the car. And I was like, hate this. Hesitancy, because as soon as we say difficulty, people always look at the end of the spectrum. They really throw themselves out and miss it, or they don't even try. They land badly. And I'm like, no, it's I don't think I'm going to make it. That could hurt me. I'm just going to go play with my friend rather than jump in the car. I don't really want to do it. So I still love you, but I'm going to pretend I didn't hear you. That sort of thing. And I think we overlook that they are so loyal. They're so well behaved. We have a duty of care to pick up on those subtleties, don't we?
Yeah. And I think, that's really a nice point, because I think, so in this particular dog's case and Polly's case as well, so the motivation then to actually come down the stairs at some point overrides the pain, right? Because either they want to go downstairs because that's where the food and the water is, or because they need to pee, or because they want to be with their people. So that motivation in behavior of wanting the outcome of the behavior of going down the stairs overrides the pain. And that's the thing that makes my heart break, is that they do it anyway, even though they're sore. They want to be with you so badly, or they need access to really vital resources. And so they do it anyway, even though it's uncomfortable, it's painful, and it's sore. And that's the piece where I then think, oh, I'm sorry. I'm just sorry. We should be seeing that and helping you.
I want to stay here a little bit longer. I want to stay exactly here and talk about motivation, because they will do it even if it hurts, is a phrase that we use a lot. And let's just bed down in this statement, because it applies to so much. I've just been to my sister's house. I love her to bits, and she won't mind me saying this. And her cat, she said, when he lays down, he's just kind of holding his paw a little bit weird, but he still jumps in the window to get to the food, and he still go out to the toilet, and I've still seen him try and chase birds, so it can't hurt him. And I'm like, no, it doesn't work like that. So let's stay with this seesaw, the motivation kind of seesaw, in that the motivation eventually wins. The need for the resource, the need to go outside and pee, the need to get to the food, the need to get to the water, the need to get to safety. Use this as your opportunity to tell the world and get this dealt with, because they will do it even if it hurts.
Yeah, they will. I mean, look, when it gets to like the end stage, you know, then they won't anymore. That's when you get the cats that don't want to use the litter boxes anymore, and then the dogs that start having house soiling accidents because they physically can't access the garden, they can't go down those steps anymore. But that's the end game. That's the end stage when, you know, things are really bad. But that whole time beforehand, the motivation will likely outweigh. And behavioral motivation is such a strong driver, you know, of behavior. And often those social aspects, especially with dogs, cats not so much, but especially dogs, you know, those social drivers, they're a very social species, and those social interactions and social drivers will be massively motivating, you know, as will be things like fear, or for cats, predatory behavior, hunting behavior, so hardwired in their DNA. And it's very difficult to, or we shouldn't underestimate those motivators because they're so strong. And then obviously there's a whole bunch of stuff that happens in the physiology and in the brain as well, in terms of, you know, the classic is, well, he still loves running when we go for walks, so he can't be in pain. And well, no, you know, that motivation to do that behavior, but also potentially the release of endorphins and all that kind of stuff that comes with it. That's the seesaw, where then the behavior becomes more motivating, and there's potentially even a positive kickback from performing that behavior in terms of, you know, releasing those endogenous opioids and other sort of pleasure substances, that dopamine, you know, big one, that then tilts the seesaw the other way. So that does not mean that pain isn't there. It just means that something else is a stronger motivator. And I don't know how else to say it even more clearly.
I used this the other day when I was talking to somebody. I used to consider myself quite agile. I'm now 44 and things beginning to get a little bit stiff. And the less exercise I do, the more stiff I get. You know, the more laptop time, the more my back begins to hurt, my neck hurts. You know, keeping moving is so important. And I've been recently living in Bude, and we've got beautiful rock pools, and you can jump down onto the sand and you can climb over the rocks. And I've watched the way that I move, and I'm a lot more hesitant. I still do it. I'll still climb over the rock pools, and I'll climb over here, there. But I know that I might slip and not cope. And as I jump onto sand, it might reverberate through my knees. So you'll still see me do it, but I'm going to do it slower. And when I say that to people, they're going to go, yeah, I'm actually the same. And yeah, it's because I've got a little bit of underlying pain. Oh, yes, get you. So it's really important that we challenge this. You know, he wouldn't do if it hurts. No, they would. There's a whole nother rabbit hole we could go down with, which is trying to get them to do stuff, even though it might hurt, but to get them moving. But we're not going to go there yet. Right, next case. Let's go a bit more subtle.
Okay, let's go. Well, actually, I'm going to do one more that's a little bit not so much subtle, but it's a different type of pain. So this is a French bulldog called Dexter. Love him to pieces. And again, I'm going to go with aggressive behaviors, or a case with aggressive behaviors here, because it's kind of a little bit the classic. But in this case, it wasn't osteoarthritic pain. In this case, it was atopic dermatitis, so allergic skin disease, which at times would cause the whole of his belly to inflame in a horrible rash, and affect also his ears, his front paws, armpits and groin, you know, the classic places of sort of allergic skin disease. And whenever somebody would reach over and touch him, and these could be family members or visitors, and it happened with both, whenever somebody kind of reached over and went to stroke his belly, he snapped. And again, it was quite a sort of an easy link, but I think it's an interesting one because pain can come from so many different areas. And I know that, you know, Cam deals mainly with osteoarthritic pain, but it's just something else to think about because there are so many different types of pain. And sometimes it's not just pain, it could also be discomfort or that kind of burning sensation, that inflammation, or feeling itchy, overly itchy even, that can, you know, cause this this type of defensive behavior. But he was basically just saying in that moment, don't touch me. I really don't like it. It doesn't feel good, and just sort of stay away. And that was also a little bit of it took a little bit of education and communication with Dexter's mum to kind of understand her make that link. And actually, I think it's last year, we had a fantastic paper published making the connection between atopic dermatitis and increased anxiety and increased aggressive behaviors. So there's a nice piece of literature that came out at kind of just around the time that I was seeing Dexter, you know, that helped support me in saying, look, we've got this evidence here. We've just had a paper published on this, and it's a thing, you know, it's really a thing. And so for him, it was really key to manage his skin disease, his atopic dermatitis. And yeah, that was, you know, that was a really big, a big change for him. And yeah, and, you know, and there would still be flare-ups. So as we all know, it's really difficult to manage allergic skin disease. It's an ongoing problem, and occasionally he'd have flare-ups. And whenever he had a flare-up, he would again get a little bit grumpy and snappy. And so it was starting to recognize those patterns and then starting to implement the treatment that would help level out these kind of flare-ups.
No, I think this is a perfect opportunity, because I may be biased towards arthritis and chronic pain, but I'm certainly still a first opinion vet. And quite often I sit there at work and think we're so lucky that dogs are more as tolerant as they are. When, as the lovely witchy nurse Frances says, you know, ear disease. I've now got to the point as a first opinion vet that I'm like, we're going to treat the inflammation and then I'm going to see you back and I'll clean, I'll inspect. Because if my ear looked like it had 3rd-degree burns in it and somebody pushed a scope down to look and held me on the table whilst doing so, I'd probably punch someone.
Yeah.
So I think we have to be really cognizant about what is pleasant. How can we make it more comfortable before we do anything a little bit more invasive? But there's so many conditions: dental disease, skin disease, you know, ear disease, gastric problems, bladder problems. There's so much. And when you look how often we do actually have aversive behavior, it's quite rare. Dogs are amazing. Nice people. Okay, so let's move on to the next one. Let's go for something maybe a little bit trickier.
Yeah. Okay. So this was a tricky one. I have it in the top of my mind because it really was quite tricky. So this is actually a little doggy who, Lily, her name is, little crossbreed. We call them desert dogs over here. She also, I think, middle-aged, 5 or 6 years old. And she presented, so she experienced quite a bit of trauma in her sort of early past. And she presented with being really fearful, anxious, very much shut down. You know, whenever she went out for a walk, she would almost want to come straight back home again, you know, very much crouched, hunched, tail tucked, you know, lowered body position, and just really, really fearful. And with her, it took me a little while. So there were no obvious signs of pain, and we really looked for musculoskeletal pain. There weren't really any obvious signs of that. However, she had always had a really poor appetite. And so that was then a little bit of a kind of a red flag to think about, hang on a second, is there gastrointestinal discomfort, gastrointestinal pain, maybe disease there? So we did go down that rabbit hole. And we did a whole kind of bunch of sort of investigation. And as is so often the case, it didn't really yield anything massively obvious. So it was quite a tricky case. You know, pancreatitis tests came back negative, all that kind of stuff, even, you know, more sort of complex GI investigations. And then we started to have a look at her diet, and we actually put her on a kind of a sensitivity type diet. I think it might have been Royal Canin, gastrointestinal sensitivity and skin, or something like that. And that diet change made a massive, massive, massive difference to her. She, all of a sudden, she really enjoyed her food. And with that then came joyfulness at home. She was more playful. She was more interactive and social with her mum. She still didn't love going on walks, because I do think there was a true kind of trauma piece there. But it just her change in how she felt at home and how she was able to express things. She would play more and have these like silly episodes of bouncing around on the bed, and a place that she felt really safe and was much more loving and cuddly with her mum. And that for her, for this particular dog, was a significant change in behavior, improvement in quality of life, improvement in almost welfare, I'd say, for this little dog. And I wonder, and I can't be sure, but I wonder whether there was an underlying food sensitivity, something that just made her feel chronically sick, unwell. She didn't show any obvious signs of nausea other than the reduced appetite. But and we all know how that feels as well. If you have gastrointestinal pain and discomfort, you probably still would eat, but you'd be a little bit like, meh.
Yeah.
And it would affect how you feel. It would affect your mood. So that was a tricky one and a subtle one. But
how long did it take you to work that case up so we can start managing people's expectations?
Yeah, and I was just about to say that it sometimes takes a little bit of perseverance, and not to just go, yeah, sorry, can't really find anything obvious. Let's just kind of see how things go. It took, I'm going to say it took us almost a year to fully work that out. I mean, we used other things as well. We did put her on psychopharmaceutical medication, which helped a lot. But again, it wasn't until we got that final piece of the puzzle, that physiological piece of the puzzle, which all of a sudden was like, oh my God, like she's so different. Yeah. So yes.
I think that's something that I'd like to, we'll pause before we do another case, is I think we need to definitely look at managing people's expectations. And I think we need to start right at the beginning, being able to get hold of a behaviourist that's suitable for the case, getting hold of a behaviourist that may need to work with a vet in decision-making, diagnostics, as you say, the psychopharmacologicals that might be needed to open up the opportunity to learn, reduce the anxiety levels, give them a chance to actually stop panicking, but think. And that's a process in itself, so finding a vet that's going to then take you the next step, introduce you to the right person, they're going to work as a team, the diagnostics are going to be done, the resultant changes put in place, do they have the desired effect on the pathophysiological process that we think is driving the potential behavior change? Months.
Yeah, absolutely. And then even the onboarding process of a lot of the psychopharmaceuticals. So it takes 4 to 6 weeks for the psychopharmaceuticals to actually take effect and have an anxiolytic effect. And so let's say we perhaps initially chose a psychopharmaceutical that didn't have the desired effect, and then we had to change to another one that's going to take another 4 to 6 weeks to take effect. That's potentially already 12 weeks. So that's 3 months of just going through that process. You want to, in parallel, then, of course, start working up other things. But that sometimes is also very much dependent on people's capabilities of being able to do that, the financial implications of all of those things, and finding the right
to doing any of those things. You might actually have to wait until you get the dog then in a situation that they're happy to be handled for diagnostics, for interventions, etc.
And getting the right team of people on board as well to support with that whole process. That can be, like you say, that can take time. Oftentimes veterinary behaviorists, they have a long waiting list, to even kind of get in to see them. So it is a process. However, I would definitely say get started on that journey.
And then what about when we talk about the fact that it becomes a learned behavior? So say we've got a dog that's got let's say they've got a transitional vertebrae. So we're going to go French Bulldog here because it's really, really common. And that dog has always been a little bit funny. He's got a nice little wiggle. He's got a funny trot with his back legs. He's very straight through his knees. He's very appeasing but playful, and he doesn't really let you pick him up. And over the years, he's started to become a bit snappy, and he doesn't like being picked up now. And it's actually got to the point where the owner's begun to find that they've lost confidence going to pick him up and just pop him in the car. So this has become a very established behavior. You pick me up, it might hurt. So I'm not cool with that anymore. What kind of timescale, if we were able to control the pain, so we've got neuropathic pain, potentially inflammatory pain, it's been there for years. What are we looking at trying to get that dog into a position where they are going to be okay with you coming from nowhere and picking them up?
Yeah. And that's really important because that learned behavior, the learning that's occurred around that behavior is really, really strong, because it is essentially a protective behavior. It's a behavior that is going to help that dog survive. It's going to, it's a behavior that's kind of based on survival instincts. So the learning that occurs around that behavior is really, really strong. And so the pathways that kind of form in the brain as a result of that learning are also going to be really strong, and undoing that can take time. I think it depends a little bit on the type of professional that you can get to support in that. So if you have a really amazing behaviorist or trainer, let's say, that's really well versed in working with dogs, not just from an operant point of view, but also from an emotional standpoint. And there aren't many trainers that are great at that kind of stuff. And that really kind of take into consideration the emotional state and the learning that's occurred around that. I mean, it could happen quite quickly. You can get some quick wins quite quickly, but to really sort of reverse that type of learning, it might never happen. Or, we could be talking months, 3-6 months, that kind of thing.
And I think the sign of somebody that is really good to work with is they give you almost like a visual analog scale, which means a line, and you put a mark, some bad to good. Where are you?
Yeah.
And then the next time you see them, so where are you now? Well, I'm a bit better. And a bit better. And if you can talk to somebody, you're heading in the right direction. I never promised it was going to be a light switch. Yeah. And I think people need to have that really understood at the beginning. I think it's like skin cases. A lot of people drop off because no one managed their expectations at the beginning.
Yeah.
What
I found in my experience is that, let's say we do start on a scale from, let's say 0 is really, really awful and 10 is perfect. That's where I'd like it to be. People are starting on a 0 or a 1 or a 2. By the time they've reached a 7, they're like, it's so much better. And their expectation of reaching a 10 doesn't even matter anymore. They don't even care about reaching the 10 because they're happy with that 7 that they've reached. So, a lot of the time, and I'll often ask the question of, if it were never to get any better than it is right now, would you be okay with that? And people are like, it's absolutely manageable. We can live with it. It's fine. It doesn't have to be a perfect 10. So people end up managing their own expectations if you give them a tool to be able to do so.
Yeah, definitely. Love that. Okay, so let's do one more because we've only got 14 minutes. And the truth is, I want to go and listen to Sam Lindley. I don't know if you know, she's doing a talk tonight. And she's a little bit of a hero of mine. So let's do another case, but we're going to leave the final 5 minutes because I'm going to put you on the spot and do your 10 top tips for OA management because it's so important. Give us another case.
So I'm going to use actually my dog Polly, who I've mentioned a couple of times this evening. I'm going to use her as my final case just because she's taught me so much and her changes are so subtle. So imagine Polly, she's 12 now. She again is a little desert dog. She's a little 15-kilo, beautiful blonde girl. And she is probably the loveliest dog that you will ever meet. Polly would never in a million years think about snapping or becoming defensive, even though she has quite severe osteoarthritis of her spine and her hips. So she shows her discomfort and how she's doing in other ways. And the way that my husband and I have realized we can try and judge how well is she doing at the moment is by how much she licks her elbows, her front legs, her little carpi, so her wrists, and her arthritis locus is far away from her front legs. Mm-hmm. So it's mainly centered around or focused around her lumbar spine and kind of her tail base and her hips. Yet she shows us that she's not feeling great by licking her front legs. So that's a little bit about the subtlety of behavior changes. And some dogs are just not the type of dogs that might go to those big behaviors, those big demonstrative behaviors. They're much more, their temperament and their personality is such that they're just much more subtle about how they express their own personal pain. And I think, Hannah, you'll probably have a million different examples of the same thing.
My dog,
really?
She licked furniture.
Oh my God. See?
Yeah. So anybody that wants to learn the hard way, I've actually had quite a few people contact me. We've got a course out called CAM Advocate Level 1. And module 1 is the intention is to make you cry. It's harsh. So I use a lot of things that happen to Holly to kind of guide people. So module 1 is going through a health check every year with a dog that's 16, 15, 14, 13, all the way down. to when she was a puppy. Some of them are true. Some of them are things that I've learned from other dogs, but they were opportunities not to be missed. They're called PIPs, potential intervention points. And it might be that she was licking furniture. It might be that she ran and she'd stop and just hold up a leg, and then 2 seconds and she'd be off running again. It might be that some days the whites of her eyes would be more, her tail would drop, or she'd drag a toe. There were so many things that when I look back, I go, what a twat. I could have done something earlier, but I didn't know. know. So if you want to do a course that kind of really expands your mind and makes you start sitting there with your ears pricked at every opportunity seeing a dog, I'd like to say that that's a good introduction for you. So potential intervention points, module 1 of CAM Advocate, level 1. But yeah, she used to lick furniture.
Oh,
yeah.
See, I mean, it's just, yeah. And yeah.
But this is where I'm going to probably get myself into trouble. So there's some really great tools out there. So they're called clinical metrology instruments. They're amazing. And they've had so many hours, so much time, so much attention from seriously brilliant thought leaders. But they don't talk about these weird things.
Yeah.
You know, there's no, does your dog lick furniture on a scale of 1 to 10? How bad is it? And so these little weirdities, behavioural changes, can often get overlooked in these tools that we use to guide us of the severity or the presence of pain. And that's why, and I'm just going to big Cam up. Sorry, I'm just we've got something called the chronic pain indicator chart, and hopefully the lovely Lynn will put a link to it. And it is there to try and fill the gaps in many ways of identifying what your dog does that you now realize tells you that they're uncomfortable, because it might be that that is the indicator that changes. And it might be the licking of the paws, the licking of the furniture, but then you can put it on your chart in your brain of how bad is that at the moment? Oh, not licking much. So we're in a good place. So yeah, like a Lynn, she's like a PA that I never had.
Oh, very good. But I think that's another really important thing to say is that as well, I don't know when you were in vet school, but certainly when I was in vet school, we weren't taught, hey, a dog doing XYZ could mean that they might be in pain, right? We were never taught that. And, you know, many vets wouldn't know that, which is why, yes, number one, experience, you know, you and I have seen some of these sort of challenging cases. So experience teaches us that it can be really crazy. However, that's why the caregivers, they need to be our eyes and ears as vets. And kind of make sure you flag these things to your vet. And, you know, if you find a really, really great vet, they'll sit up and take notice of those things that you say. So, yeah, I think, you know, just empowering you as caregivers to be the ones that know your dogs and cats the best. Yeah. So don't be shy to notice those things. And, you know, don't think, oh, I might be making this up or maybe it's nothing. No, if you're noticing a change, it's something.
Yeah, and that's where that suspicion of chronic pain document comes in, because I'm going to make a confession that I've said many times before. I can remember an owner coming to me and saying, doesn't really use his tail much anymore. Is that something I should worry about? And I think I was about 1 year, 2 years qualified. I was like, I haven't been taught anything about tail use, so I'm going to say it's okay. You know, if somebody came to me when I was 2 years qualified and said, he uses the whites of his eyes more, I'd be like, I don't know what that means. But the idea is that you collect a number of observations and it will channel your brain of going, whites of the eyes, drop tail, not at the, you know, greet me at the front door. Oh, wait a minute, there's a lot to unpack here, and they're all pointing to this chronic pain center point. So please do use that suspicion of chronic pain PDF, because your vet might listen to your subtle observation and go, what? And then the next step is, we know that many of the interventions that we have at our fingertips may make the situation worse. Shouldn't do, but may, in that. Can you imagine if somebody said, my dog's using the whites of his eyes more, and I just go, here's a month of meloxicam, and then the dog comes back with diarrhea. Well, he's still using the whites of his eyes, and now he's got diarrhea, so thank you very much. So you can see why vets go, I'm not prescribing nothing with such a subtle change. So you've got to work with your vet on this one. Okay, there you go. A little bit of a giggle moment. Right, you can't get away with it. We've got 5 minutes. 10 top tips for OA. Now, do you want to do 10 or do you want to do 5?
I'll do 5. You could do 5.
Okay, I'll start with number 10 then. Use the suspicion of chronic pain PDF when you first approach your vet. As Jamie McClement has said in VOA conference last week, it could be the most important consultation of their life. Go prepared. Use the materials that we provided for you. Go prepared. Right, number 9.
Number 9 is, I'm going to come back to something we spoke about a little bit earlier, which is the home adjustments. So putting rugs on stairs or just having more rugs in general. Hang on, haven't you got a good hashtag for that?
More rugs, less drugs.
Yeah, more rugs, less drugs. That's it, exactly. So yeah, make those home adjustments. I found that that's made a massive difference for my dog, and yep, that's a good one.
So my number 8 is exercise. Open your mind to what exercise is. So there's different terrains, there's different lengths, there's different frequencies, there's different times of the day, there's with friends, without friends, there's with toys, without toys. There is so much. When we say think about exercising your dog, look at different modifications that you can do. Exercise is absolutely paramount to their quality of life and to managing the disease, but too much exercise or inappropriate exercise can certainly make it worse. So think about that.
Number 7 is, I'm going to go for a little bit of a behavioral one here. So using things like stuffed Kongs, food puzzle toys, distractors almost, that take your pet's mind off thinking about their pain. So giving them something else to do in that moment will shift their attention away from perhaps the experience of pain that they're having in that moment. So as part of your multimodal plan, that's a good behavioral tool to kind of fit in there.
I love it. Number 6, so we dropped out of Facebook and now we're dropping back in. It's been a pain in the bum. Having trouble streaming to Facebook. This is a problem on Facebook's end. So I'm afraid we will just keep going on YouTube and then hopefully people will share again. So number 6 for me, I'm going to play in the lifestyle again, bedding. We have done a lot of work with Amber Batson about the importance of sleep. They are polyphasic sleepers. They need multiple aliquots. They need anything between 12 and 14, 16 hours sleep a day. It is an important physiological requirement. So make sure that their bedding is safe, easily accessible, comfortable. They can stretch out, they can curl up. It isn't full of toys, it isn't full of blankets they're going to get their feet caught up in. Fluffy pink with feathers doesn't make it a good bed. Generally, the most boring ones that look really dull are pretty damn good. So think about bedding. Number 5.
Right. So I'm going to also carry on in the vein of lifestyle. So I'm going to talk about collars, harnesses, and leads. So there's nothing that I hate more than a retractable lead on a neck collar. That the dog gets to the end of the lead and all of a sudden, or you kind of clip it quickly and the dog gets to the end of the lead and gets a nice jar around their cervical spine or their neck. So please don't use retractable leads and try and stay away from neck collars, but rather use really good quality padded harnesses that fit really well. I love Freedom harnesses. Sometimes you can get harnesses that have kind of bits and bobs that you can kind of hold on to and lift and help them maneuver. So yeah, just be a little bit mindful of what you clothe your pets in, dogs, I guess.
Love that. Good job. So number 4, the truth is, by the time that we notice there's a problem, there's the likelihood our dogs are going to be in significant amount of pain. And there's a very famous vet, the awesome Dr. Katrin, who's been on CAM before, who has said on countless occasions, for a dog to be showing signs of pain, they're likely to be 7 out of 10 bad, So if you are taking your dog to the vet with the suspicion of pain, let's be honest, it could be quite significant. So do not be shy of pharmaceutical interventions, because at present, that is the most evidence that we've got. There've been lots of clinical trials looking at the speed of efficacy, the efficacy in total, the safety. You might not believe in pharmaceuticals long term, but your dog's going, I don't care what you do, but just make it stop soon. So please do not dismiss the role of pharmaceuticals. Number 3.
Number 3, I'm going to go for a multimodal approach. So it's something that we use a lot in behavior medicine, and I think there's a big crossover there to pain management. So we have so many different modalities of pain management that it is really great to investigate all the different options that are open to you. So absolutely, pharmaceuticals, medication is one big part, and then there are so many others, all of your sort of adjunct therapies, physiotherapies, massage, all the other bits and bobs, but always consider, in-home management, everything else that all the other 10 points that we've just said, but always think about it as being a multimodal, holistic approach to get a best outcome.
I love that. Number 2 for me has definitely got to be you are in charge. So you've got to be the people that observe and see improvement and deterioration. So we believe in the 4 E's, which is educate, enable, engage and empower. So we're trying to get our owners to feel confident to be part of the process. But if you don't go back to your professional, be it a therapist or a vet, going, yes, what you did last week, I saw an improvement that lasted 4 or 5 days, or the drug that you started 4 weeks ago, I've seen a general steady improvement. Without you, we're just stabbing in the dark. So start being really observant, use the tools that are available, be part of the plan. Number 1.
Yeah, so mine's a little bit similar. You kind of took my number 1 away from me. That's fine. I'm going to say use a collaborative approach. So surround yourself with professionals that you like, trust, and who you believe have good education and knowledge around this topic. And it takes a village, it takes a team often to treat both behavior and chronic pain, osteoarthritis. So get your team together and surround yourself with people that are going to support you and be there for you.
Totally agree. And hopefully over the next few years, CAM's going to be starting to make a map where we have CAM trained practices start to show themselves, which had the lovely Dr. Katrin Jahn. We did it was about 2 years ago. It was in COVID.
I know, it was in COVID. Yeah. It was right at the beginning of COVID, yeah.
Yeah, and it was it was just such a lovely thing to be able to do. You were my first proper international training. Yay! And it just made my heart sing. I was so happy that the message was getting out there. So do encourage your practices to engage with CAM. We do practice trainings. We really want you to have that best experience, whatever practice you go to. Reception, vets and nurses together, understanding your dog's needs, and therefore we'll get your dog more years. Right, I'm going to dash because, as I say, Sam Linley is awesome. She's on Future CPD tonight, so just in case you want to go and check it out. Thank you so much, Katrin. It's just lovely. Such
a pleasure.
We will catch up with wine as promised before we went live.
Let's do that.
Perfect. Take care, CAM followers. We will see you next week. Join the member zone because there's so much more like this in there. Take care. Bye.
Bye.